We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country in hotspots, the numbers are holding steady here in Florida. And this leaves many residents questioning what they should do next. Face masks are required throughout many Central Florida communities, and testing sites remain open to accommodate the numbers. So, what does all of that mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Our first guest is the very busy Orange County Mayor Jerry Demings to give us an update on what's going on here in Orange County. Mayor, thank you for joining us. And I know you've been very busy with lots of things happening. We want to find out what is happening here in Orange County as it relates to the coronavirus and how we're doing in fighting the pandemic.
Well, Clarence, let me begin by saying thank you for inviting me to be on the show once again and provide a brief update. Overall, Orange County is faring better than it had in several months now. Even though we have over 38,000 cases here within Orange County, and I have to sadly report that 426 people have died as a result of the coronavirus itself, what we do see are some declining numbers. Within the last 14-day period of time, our positivity rate has dipped below 5%. In fact, it's approximately 4%, which is good news for our community because the experts tell us that in order to successfully contain the virus, you should see positivity rates of 5% or below. And I believe that we have reached this pinnacle at this time because the residents of Orange County have worked with us by wearing masks and by social distancing and doing all of those CDC recommended activities to keep themselves safe over time has resulted in a reduction in the numbers that we see here within Orange County. So I applaud those efforts. We are reopening businesses. Just earlier this week, bars reopened throughout the state of Florida. And certainly we want them to be successful in their reopening efforts. We know that there had been historically some outbreaks associated with individuals who were patrons at bars and, quite frankly, with bar owners who were not being compliant with the CDC guidelines. The Florida Department of Business and Professional Regulations and the Secretary has said that they are going to closely monitor this reopening of bars because they really have the regulatory or the enforcement over alcohol and beverage establishments here within the state of Florida. In addition, here within Orange County, we have compliance or strike teams that have been going out to ensure that businesses have been remain compliant with the orders that we have in place regarding facial coverings and other things here within our community. And I'm happy to report that over 94% of the businesses have been compliant with our orders that we have in place. So we still have to run through the finish line as a community. That means that we still have to continue to embrace these CDC protocols, and we should have a positive experience as a result of that.
And when it comes to talking about testing, it is still going on here in Orange County. I know that it's modifying, it's moving around, but we are still doing testing here. Is that correct?
We are still doing testing. Orange County now has about 1.4 million permanent residents, and we have tested over 330,000 of those residents over time. And so we still see individuals who desire to be tested within our community. So we have numerous free testing locations. We move throughout the county. We work with the Orange County Health Department and Orange County Health Services to make sure that testing continues. There are also some private sector providers who are working with the community to provide testing at locations from the Walgreens or the CVS to True Health, and some others are offering free testing as well. So we encourage our residents to make certain that they get out and take advantage of the free testing related to the novel coronavirus itself, but also flu season is upon us, and many of these locations that I just cited also are offering free flu tests as well, or vaccination. So we want to make certain that the individuals get vaccinated during the flu season, because we don't want to have the confluence of both a pandemic and a major flu outbreak within our community. So we can be proactive and help keep ourselves healthy and safe by doing these things that I am suggesting now.
I got my flu shot yesterday. Thank you very much. I know that the...
Well, you beat me. I'm going to get mine next week.
Oh, yeah. I happen to be in CVS, so that's the only reason I did it. But I know that the eviction moratorium is going to be extended until December 31st nationally, but evictions are still an issue. How is the COVID-19 eviction diversion program going?
Here within Orange County, we allocated $20 million of our $243 million or so in CARES Act funding to address eviction diversion. In order for individuals to qualify for the program, certainly there has to be some agreement between both the tenant and the landlord, and that program is going fairly well. You can go to our Orange County website at ocfl.net/eviction diversion, and you can get information about how to qualify for the program, how to make application. We're working with some local nonprofits like the Bar Association here to help us process the applications for the crisis assistance that we're offering here within our community. You can also just simply dial 311 from your cellular phone or landline phone, or you can go to our website again and get information.
And Mr. Mayor, I want to give you an opportunity to talk a little bit about the importance of wearing a mask and social distancing. We here in Orange County are in a unique environment where we have thousands, tens of thousands of visitors coming into our space here. From all over the country, all over the world, even during the pandemic. Why is it important for us here to be an example to all of those people visiting and make sure that we're wearing our mask in public and that we're also social distancing?
It's important that we all make a conscious effort to wear our facial coverings and to socially distance, because that is what the science tells us is the sure way to stop the spread. Of course, this is a virus that is primarily transmitted through the air by individuals breathing out and breathing in. And so when individuals travel here from other locations, we don't know where they have come from. So wearing a mask not only helps to protect the individual, but it helps to protect all of us from transmitting the virus ourselves to others. So we can all help one another by wearing the mask. I believe that until we have a vaccine or we have a cure for the coronavirus itself, the virus is going to continue to live with us. So that's going to take several months from now before we reach the point where a vaccine is widely available to our residents. Most people estimate that that will be by the end of the year or the first of next year before we will have widespread vaccines.
Well, Mr. Mayor, thank you so much for taking time out of your busy schedule to be with us today.
Thank you. It's always good to be on the show, and hopefully this information is important to all of us. So together, we can accomplish the goal if we stay safer, stronger together.
Absolutely. Thank you so much. We'll be right back with more. Stay with us. Let's get an update from our local medical professionals, and joining me is Dr. Thomas Prince, Medical Director with the Florida Department of Health in Orange County. Dr. Prince, thanks for being with us today.
That's my pleasure.
So tell us about the pandemic numbers here in Florida. How are we doing in our ability to stave off the numbers growing?
Oh, goodness. Well, I would say most recently we've actually had a very relatively low rate of growth. The virus will spread or grow at an exponential level, in an exponential fashion, if left to its own devices. And we've actually been able to flatten the curve somewhat. For the last couple of months, we've done pretty well, quite frankly. A lot of concern, obviously, over the opening of schools and the general increase in activity outside of the house, but still the rate of positivity has stayed pretty good. So I would say I think we're doing well. Some people would say, we could do much better, and I'm not going to argue with them. But from my perspective, I think a number of the things we've done have been able to flatten the curve and keep the people out of the hospital. Our hospitals have not been overstressed, and I think we're going along pretty well. We're on target, I think, for getting a vaccine, and if we have that vaccine, then perhaps we can finally begin putting away these masks.
Absolutely. You mentioned school starting, and I know that one of the things that we really need to be careful with is multi-generational transmission with kids going into a school environment. Is that something that we need to be careful of, and what should we do with our elderly that might be in the home?
Well, I agree with you on that concern regarding the vulnerable population being potentially exposed. The children, I'm going to speak in generalities here, but the children in general they're not hurt significantly by this virus. Again, speaking in generalities. But the elderly can be quite vulnerable, particularly the elderly who have comorbid conditions, in other words, other medical problems such as diabetes, hypertension, obesity, the things that are actually rampant within our society these days. So yes, anytime you have the vulnerable, you want to protect them. And you're right, in a multi-generational home, you have the potential for a child who was at school and maybe totally asymptomatic, having picked up the COVID virus and then brought it home and potentially exposing an older, less well family member, and the consequences could be severe. So you're absolutely correct. We should be concerned about that type of thing, and so I think everybody's different in terms of what their means are. There are some places where there's no way to separate the elder in the household from the rest of the family. They're going to always be there. They're always going to be exposed to the children. So it seems to me that in a situation like that, if they've chosen to keep the child on some sort of at-home learning, that they would be in a lot better shape. Whereas, for example, if you have a home where they have the capacity to put the elder maybe in another place, or keep them upstairs where they're by themselves, generally speaking, and or a bonus room or over the garage, someplace where they can be kept well but away from the children. It seems to me that those children would have perhaps be appropriate for them to be going to school and taking the risk of getting the COVID virus.
One of the things that's happened, Dr. Prince, is that we have gained a whole new vocabulary due to this pandemic because we are learning new things. One of the things that I think confuses people has to do with the testing. Can you kind of give us an idea of the difference between the rapid testing and the PCR testing?
Yeah, I can give you an idea, and I think first off, the rapid test, what we call the rapid test, has been applied to a number of different technologies. I think I'd prefer to break the testing up into categories more like the FDA has done. We have what we call diagnostic testing, and then we have antibody testing. And actually, early on in the pandemic, the first rapid tests were actually antibody tests that were being done. Mostly came from China at the time. It was a pinprick or a little bit of blood, and they gave you a result very, very quickly. Those were what were called rapid tests at the time. Those tests were antibody tests. Antibody tests are tests that really only tell you whether or not you have had a disease in the past. So antibody testing, for example, if I'm measuring the level of antibodies in your bloodstream, what I'm looking for is a response that your body has, an immunologic response that your body has to a threat, the COVID in this case, and that antibody response develops over a period of weeks, 2 to 3 weeks in general, and that's when it becomes detectable. Actually, past the time in which the infection has gone. So the antibody testing that what used to be called the rapid testing, and now is we refer specifically to as antibody testing, that type of thing really is more useful for telling us who in the population has had this, and giving us an idea of whether or not this is something that's going to keep coming back like the flu does, or whether it's a one-time disease that, like the chicken pox, for example. The other category, the diagnostic testing that the FDA divides the testing into, has the category of the PCR, which is a molecular test, and when I say molecular, it refers to molecules, and when specifically it's nucleic acid molecules that are in a chain that where we're actually looking for parts of the viral RNA, or ribonucleic acid, the building block of the whole virus. We're looking for that in the sample. So the diagnostic test has molecular tests like the reverse transcriptase PCR test. And there are other molecular tests out there as well. Abbott has one called ID now, which many people have heard of. There's another one called Q. I believe there's one other molecular test on the market. And by the way, there are some 20, 30, 40 different PCR tests as well. So there's some variants. They're all looking at different parts of that virus's RNA. The RNA is that piece of genetic material, kind of like the DNA we have, that is able to allow the virus to make itself. We have the DNA, and the virus obviously has the RNA. There is another rapid test that they use these days that recently was more recently released, and that's the antigen test. And antigen is a piece of the protein of the virus. So the virus is composed of it's got a capsule that surrounds it, and it's got nucleus, and it's got proteins that sit in the capsule that's surrounded it, and they're nuclear proteins as well. The antigen test, which can be done in a rapid fashion, it's very quick sometimes, 20 minutes sometimes. Those tests test for the presence of that protein when they swab you. So the initial rapid tests were an antibody tests. Now the rapid tests really refer more to antigen tests, and actually now there's some molecular tests that are relatively rapid. So I don't usually use the term rapid that often, but yeah, if we want to talk about something that, what I prefer to use is something called point of care. That means that when you go to like a doctor's office or something like that, or testing site, they can test you and they can tell you then and there whether or not you have the infection. And those point of care tests, there are a number of them now. Like I said, there's the molecular test, some of the molecular tests, and the antigen test, some of the antigen tests. So I hope that helps in distinguishing that for you.
Well, Dr. Prince, thank you so much for being with us, and thank you for telling us what we
Yes,
need to know from the front lines of this pandemic. We appreciate your time.
it's my pleasure.
Have a good day. We'll be right back with more. Stay with us. Let's get an update from our local school district, and joining me is Orange County Public Schools Director of Safety, Jackie Saccamano. Jackie, thanks for being with us today.
Oh, you're welcome. It's a pleasure to be here.
And Jackie, can you tell us what the percentage is of distance learners versus face-to-face students in OCPS?
Absolutely. Right now, we have about 30% of our population who are face-to-face. 70% are doing launch ed, so they're receiving school training from home. And today actually happens to be the deadline for parents to actually switch if they would like to go to face-to-face or back to launch ed. And that will be for our second semester of school, which starts on October 13th.
And one of the things that I know a lot of parents are thinking about is what are the precautions that are being taken by OCPS before I send my child back to face-to-face learning?
Great question. Well, first off, our number one priority is, of course, the safety and health of all of our students and our staff. So we've taken extensive measures to make sure that we have hand sanitizing stations throughout our schools. We do have a mask policy that requires mask as well as and/or face coverings. We also have developed standardized signage throughout the entire school where we're training our students and staff how to correctly physical distance. So just like you would see going into Publix or anywhere else, we have the floor markings telling them which way to travel. We have great information that teaches our students how to properly hand sanitize and focus on good hygiene. We've also developed it's called the COVID-19 Health and Safety Procedures Manual. It is out on our website, and it has all of the details for every single plan, procedure that we have developed for all of our students. So if they do have questions, they can go back there and reflect. There's a great question and answer section, Q&A, as well as we have created training videos to help our students and staff adapt to this new lifestyle.
And you mentioned the staff. What has changed for teachers and staff inside the schools?
Wow, a lot has really changed, and I give so much credit to these teachers trying to learn so many different new techniques in such a short period of time. So our teachers had the opportunity to decide whether they wanted to teach face-to-face in the school system or if they wanted to do launch ed from home or even do something called blended learning. But these teachers are at home doing using technology to give live classes to our students so that they can have that question and answer. We know our students need to have that social aspect. So the kids are participating right in class, sometimes with students that are face-to-face in the classroom, as well as those that are at home they can interact, they can ask questions, and they can hear feedback from their classmates. So teachers and faculty, as well as staff, really have had to do the same adjustments that our students have. They're wearing face coverings. They are keeping and maintaining social distancing. They are, making sure that when they're eating, they're staying at social distancing locations so they can remove their mask. Just doing everything possible to make sure that we are staying healthy and safe.
And what precautions are being taken just in case there is an outbreak inside of a school?
Okay, great question. Well, first off, we try to focus on preventative measures. So those are all of the things we're hoping that COVID does not spread throughout our school. But if a student or a staff actually has COVID or starts to have symptoms, we do have several things in place. So we have what we call our isolation. So if a student, say, starts to exhibit any type of symptoms, they're sent to an isolation room where a nurse or a qualified staff member is asking various questions about their conditions. They then notify the parents of that particular situation. Parents are then directed to come and bring their students home, and then they are a mandatory 10 days of isolation at that particular point, so that unless they can come back with a negative test result, we do recommend, we don't mandate that they go and get the test, but let's say they do get the test and it comes back negative, because we do know that COVID-19 mimics other symptoms for the flu or sinuses, allergies. So we just do everything possible to make sure that we are being overly cautious with those individuals. We record then any students that may have been in close contact, and that information is provided to the Department of Health, and they determine if those individuals need to be quarantined for 14 days because of the close exposure.
Well, Jackie, thank you so much for being with us, and thank you for keeping our students safe.
You're welcome. Thank you so much.
And stay with us. We'll be right back with more. For many Orange County public school students, school might be the only place they can get decent food to eat. Currently, 7 out of 10 students in Orange County are eligible to receive free school meals, and some families may be relying on meal benefits for the first time ever due to the pandemic. The Food and Nutrition Services Director at OCPS, Lora Gilbert, is here to tell us about that. Lora, thank you for being with us today.
Thank you for having me.
Absolutely. Take us back to the beginning of the pandemic, back around spring, when we were just learning what this coronavirus was. Tell us about what food services were being offered in schools back then.
Well, I think it was right over spring break. We were learning that schools would not be opening again. So we were quickly pivoting to meals that could be curbside delivered. And so parents could come through and pick up the meals and take them home. We soon learned that the parents really only wanted to come out maybe 3 days a week. And now we've pivoted so that the parents only need to come one time a week and pick up meals. And that's Monday afternoons and evenings. So we've done a lot of things. We've switched to some things that are shelf stable. We have some things that are refrigerated. And I think we heard the parents during the summer tell us that they really wanted something they could take home, put it in the freezer, and then heat it up so that it was hot on the day that they needed it. So we've made a lot of changes over this period of time.
A lot of people might be shocked that the lack of food here in Orange County is a big problem that really does show up in students first. Tell us what you're seeing in Orange County schools.
So I think the best example that I can talk about is the toilet paper. When we found out that there was a shortage, we all wanted more. And I think that's the thing that happens with children is as soon as there's a shortage of food, they want more. And so they're a little bit more particular about what they want. And I think that's where the school district can come in and help out. We've done a lot of research, a lot of focus group with kids. And so we tend to get it right when we serve things. So for instance, we've got the Mandarin chicken leg, we've got the chicken tender salad, and we always serve things with the ranch dressing or the hot sauce or the honey mustard sauce that the kids like. We've got the French bread pizza, but I think you also need to take a look at the different fruits and vegetables. And I think that's the thing that when kids are sitting down and actually parents are grocery shopping, it's really difficult to bring home enough fruits and vegetables for the entire week. So this is our chance to help out families.
Well, it definitely has evolved since my school days. And I know that because of the pandemic, a lot of students are not in school and are choosing to do their schoolwork from home. What programs do you have in place for them?
So we have our curbside pickup. And now that USDA has given us a waiver, what we do is we serve all 7 meals for the week on Monday evening. And so 30 minutes after a school closes, our lines open up and the parents can come through and get meals not only for their school children, but if they have toddlers, anyone age 18 and under can come through and get the meals. So, this is the amount of milk that you will get in 7 days worth of breakfast, lunch, and sometimes supper. this is the amount of produce. And so, again, you may not know that your kids like cherry tomatoes, but we've done a lot of research and we know that they like broccoli and cherry tomatoes with ranch dressing. So this is a good chance to check it out in terms of the apples, oranges, and we're going to come into citrus season soon. So we'll have the seasonal produce. But again, the things that you will get from the district are the things that kids like. So we have the bagels, we have pancakes, we have French toast sticks, banana bread, everything that can be put into the freezer. And then when it's thawed out and heated up, you can serve it throughout the week. So, I think it's an extremely stressful time. And I really want to make sure that parents know we're here to help them. This is something that you don't have to think about what supper is looking like tonight for you, because we've got the breakfast cereals and the breakfast bars, cheese sticks, turkey sticks, all of the things that the kids enjoy. So you may be surprised. You're going to see some brand names that your kids really are your favorites.
That's excellent. And are there requirements for the program, family income or anything like that, in order to take advantage of the curbside pickup?
That's a really good question. Right now, there is not. Any child or parent coming through just has to bring the child's name. So that's all we're requiring right now. But I want to make sure that I mention that the benefits need to be renewed. So if people have not filled out an application for free or reduced meals, the time to do that is now. I want to point this out because if people are not getting income benefits from SNAP or they have a TANF number, they need to apply for our free and reduced meals, because this gets them the discounts for utilities, Wi-Fi. They get discounted fees for summer camps. And last year, the pandemic EBT card was mailed to families that had an application with us, but they were not receiving the federal benefits. So if that pandemic EBT card comes out again, they'll receive money on that card. So it's really important to make sure that they've got their applications on file. And this waiver for us lasts until December 17th. So we're really encouraging families to go to our website and fill out the application as soon as you can.
It looks like it's keeping, my eyes are looking at the food, which looks really good, but it also really is important to keep in mind that nutrition is important for learning. They really go hand in hand. Is there anything else you'd like to leave with our viewers about the program with OCPS?
Well, I just want to emphasize that this is the best economic stimulus package that Orange County can offer parents. I think it's very stressful to figure out what your kids are going to eat every single day. And for a lot of families that can't afford to go to McDonald's, we've got the chicken nuggets and the chicken tenders for you. I would say that the fresh fruits and vegetables that are pretty expensive in the grocery store, we can help you supplement that with our fruits and vegetables that we are serving both curbside and when the kids get back to school.
Excellent. Thank you so much, Lora, for being with us, and thank you for the work that you're doing at OCPS.
Thank you. It is a great team to work for.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today working to keep you informed about the coronavirus. From local government, the medical community who is on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.